this is Dr. Kyle with ICE Clinics bringing you your next tip for Tuesday. So with our tip for Tuesdays, I like to hit the flavor of the week or the day. And we've been noticing in the clinic that we've been seeing what I suspect to be more frequently a thoracic outlet syndrome diagnosis. So just as a reminder for those of you watching, thoracic outlet syndrome, it's related to this region of our body and is usually connected to loss of sensation in the hands, fingers. Sometimes you can feel like your arm is falling asleep. There's actually a really simple orthopedic test that you can do yourself where you put your arms up to your side like this in 90-degree angles and pump fists for as long as you can. Now, if your hands start getting really fatigued or tired after 10, 15 seconds, that's a sign that you might have some impingement in your chest, shoulders, and thoracic outlet area. So come in real quick. You'll see the thoracic outlet is just a space. It's right here underneath the collarbone, between the underside of the collarbone and the rib cage. But you can also see from this angle that the shoulder blade is a major player with the thoracic outlet, and the humerus bone as well. So you have 1, 2, 3 major bones in the extremity that in conjunction with the rib cage really influence how much space is here. Now the important thing with this space is you have this bundle of nerves come off your neck right around here. This is called your brachial plexus. This is what eventually will go all the way down your arm. So if you're kinked up here, your symptoms could potentially be going all the way downwind. And what I find is actually one of the most common misdiagnoses for carpal tunnel syndrome, which have very similar symptoms and diagnostic functions to it. So one thing that I want to really encourage for you watching is a better way to address this dynamic between the collarbone, humerus, and the scapula. And I'll show you basically how we do it here in the clinic with Shayla. So first and foremost, our job is to make sure that we're moving the rib cage and the shoulder blade relative to each other. So one of my favorite adjustments for this, Shayla, I'll have you put your right hand on the back of your neck, is you'll see as I roll her up here, I'm going to take my hand, place it on the ribs here, and I'm compressing her collarbone, shoulder blade into her ribs. So I'll have you take a nice deep breath, let it out, let everything relax, and just a little pressure. We can get some good movement with that. So the adjustment's kind of paramount for that part of the procedure. Then I'll have you sit up and face that way. And typically in the clinic, we follow it up with soft tissue. So this is one of our favorite tools to use. If you want to come over this way, I'll kind of show you. We will get at what's called the subscapularis, which is a muscle on the underside of the armpit here. This is a great little tool to get up in there. It's pretty sensitive sometimes. So if you venture down that road yourself, make sure you're not digging too hard. And then this, you've seen this device a couple times with some of the treatments that we've done. This is a cold laser, and I'm going to use a setting called nerve root. And we're basically going to come on to the nerve bundle as it comes through that brachial plexus for a period of time, and then we can kind of get at the different regions around that area as well, up into the neck and all the way down the arm. So basically what I wanted to show you guys watching is at our clinic specifically, we try and take this multifaceted approach, adjustments, soft tissue therapy, and cold laser, all with the focus and the function of restoring the dynamic between shoulder blade, collarbone, and humerus, which create that thoracic outlet. So if this sounds like you watching the video, you're getting loss of sensation in the arms are falling asleep, maybe reference some of the things that we're saying, and if we can help, please don't hesitate to reach out and contact us. Again, my name is Dr. Kyle with ICE Clinics. Thanks for watching.